Distal acupuncture points are some of the most effective tools we have. I love to use them in clinic and not just for pain. Today, I'm breaking down my top 9 distal acupuncture points so you always know exactly which one to use and when. Why do distal points work so well? A meridian is a pathway of qi, right? So when you needle distally to where the pain or the problem is, you influence the whole channel, not just the area. Distal points are often stronger because you're working where qi is most accessible and least obstructed. This is channel theory at its core, the same foundation behind balance acupuncture, master tongue, and classical acupuncture. Maybe you have learned the balance method or master tongue, maybe you haven't. So today, we're going to look at those top 9 acupuncture points that are distal but so powerful. Are you ready? Let's go. Welcome back to my channel. If it's your first time here, I'm Clara from Acupuncture Academy, and I create Chinese medicine and acupuncture content for students and practitioners, making it easy to grasp and fun to learn. Let's start with number 1, stomach 36. The stomach channel runs all the way from the face down to the foot, right? It is a really long channel with 45 points. It's actually the second longest channel in the body after the bladder. Stomach 36 is the commander point for digestion. So although it's on the knee, it really helps for anything happening in the digestive system, right? And it is the commander point of the immune system. So we can use it powerfully when there is a cold or a flu or something happening and weakening the immune system. It is one of the most used points in clinic, and for good reason. It tonifies qi and it tonifies blood, and it can really truly enhance the healing process of the body. Number 2 is large intestine 4. The large intestine channel goes from the index finger all the way to the face. Large intestine 4 is the commander point of the face. So as a distal point, it is fantastic to treat anything happening on the face, like toothache, jaw pain, eyes issue, sinus problem, pain, headaches, specifically headaches that is going to be frontal or orbital behind the eyes. This is the best point. It's also, of course, a great point for pain in general. So any pain anywhere in the body, we can use it as a distal point, specifically if we combine it with liver 3, because liver 3 moves qi, large intestine 4 moves blood, and in order for blood to move, we need qi to move. Together, they are called the 4 gates, and they're a super powerful combo. Number 3 is spleen 6. I love spleen 6. This one point is where 3 channel meets, right? Spleen, kidney, and liver. So it makes it an incredible, powerful, useful point. It is incredibly useful for gynecology, women's health specifically, digestion, and mental health. Of course, it's important to note that we cannot use spleen 6 during pregnancy. And spleen 6 is also the commander point of the hips. So it makes sense because if there's anything happening in the pelvic area, which is gynecological, we want to use spleen 6. I love spleen 6. It's one of my favorite points. If you've been around, you know that stomach 40 is my all-time favorite, but I would say after that, it's between gallbladder 34 and spleen 6. Those 3 points, I could do them on everybody. Number 4 is long 7. Now, one of the things that long 7 does, it is the commander point of the neck and head. So as a distal point, if there is migraine, if there's neck pain, if there's anything happening on the head and neck, let's say sternocleidomastoid that is really tight, the scalenes are tight, no matter what's happening on the head and neck, we want to use long 7. On top of that, long 7 is the confluent point of the Ren vessel. So if there's anything affecting the Ren or conception vessel, we can use long 7, which means that if there's fertility issues or anything happening to the lung, the throat, long 7 is fantastic. And yet it is far away or distal to those areas. Number 5 is bladder 40, another commander point, this one of the lower back. So it encompasses any pain or issue happening on the lower back or sacrum area, lumbar sacrum area. So sciatica, lower back pain, sacroiliac joints issue, we want to use bladder 40 as a distal point. The bladder channel is the longest channel in the body, and it runs the entire length of the back, posterior leg all the way to the foot, right? Needling bladder 40 with spleen 6, which is the commander point of the hips, if there is a lot of issue in the hip girdle. Bladder 40 combined with spleen 6 can really help when there is issues, let's say, with the lower back, sciatica, but it travels to the front and the psoas is affected. If that whole hip girdle is affected, musculoskeletal-wise, those 2 points, distal points together, fantastic. Number 6 is bladder 60. Of course, also on the bladder channel, at the bottom of it, just above the ankle, it is a great distal point for neck pain or occipital headaches. Actually, combined with long 7, you'll get such great results. This one is also contraindicated in pregnancy. Number 7 is pericardium 6. I love this point. It opens the yin wei vessel. Specifically, when we pair it with spleen 4, which opens the yin chow vessel, it is fantastic for nausea, vomiting. It's also fantastic for anxiety, palpitation, and chest tightness or chest oppression. Again, it is of course on the pericardium channel, and the pericardium is related to the heart, so it's really good for anything happening with the heart. And yet, it is the best distal point for chest, anxiety, palpitation, and tightness. Number 8 is stomach 38. Located on the lower leg, yet one of the best distal point for shoulder issues, shoulder pain, frozen shoulder, rotator cuff injuries. You have to put this point with your local acupuncture point on the shoulder and large intestine 4 because it relieves the pain as well. Usually when I needle stomach 38, I do it on the opposite side from where the shoulder pain or issue is. Why? Because the opposite side has stronger chi, stronger blood than the weak side that is blocked. Does that make sense? This is one of my favorite points to show students how channel theory works in real life. And number 9 is kidney 1. The only point on the sole of the foot, the most grounding point, because that's the only one that touched the ground. It calms the mind. It brings everything that's happening in the head down. It brings liver yang down. So think about it. When you walk barefoot on the grass, you feel calmer. You feel more grounded. That's what kidney 1 does. It's great for anxiety, high blood pressure, or feeling really scattered with too many thoughts. Now, I could go on and on because there are a lot of distal points that we could add up to this list, but I think those 9 are so powerful, you cannot bypass them in clinic. Here's a quick tip if you're treating pain. Always needle the distal points first. Let the channel open before you add up the local Asher points. And then ask the patient to move or try to move the area that's affected. Trust the channel. Always, because after all, acupuncture rocks. As I said when we first started, distal points are one of the most powerful, useful points in clinic. Learn your channels well. And if you haven't seen my channel theory video yet, I'll have the link below for you because it's so important in order for you to get better results. And if you want to go deeper with how to select acupuncture point for effective treatment, even if you're not really sure of your diagnosis, I have a 90-minute masterclass you're going to love. The link is below for you. As always, thank you so much for being here. And remember, acupuncture rocks!